As the owner of an 8-figure home healthcare and nursing agency that consults startups, one of the most frequently asked questions I receive is how to calculate pay rates. In today's video, I'm going to break down some key points you must consider when creating your pay rates, how to determine if you're paying market rate, and review common mistakes other agencies make that could cost you millions. Welcome to Passive Workforce. Passive Workforce is a boutique consulting firm that specializes in healthcare staffing and home healthcare. We work with startups, growth stage, and mature businesses from start to exit. If this is the sort of guidance you need, subscribe to the channel and like our videos so you can stay current with the latest in this highly lucrative industry. To get started, let's talk about what goes into a pay rate and all the details that you should be considering. You see, your pay rate isn't just what you choose to pay your employees. There's a lot loaded into your pay rate that you need to understand how to calculate. My quick, simple rule of thumb is to multiply your pay rate by about 20%, and that's going to be your true cost. But how do I get to that number? The things that are going into your pay rate are your federal contributions, which include Medicare, Social Security, and federal unemployment tax. Then you have your state unemployment tax that you have to pay as an employer as well. You also have workers' comp, and sometimes you have the cost of securing the capital. This could be a line of credit, a loan, a factor agreement. All of these things are going to add to your overall payroll expense. And for those of you who make the mistake of working with a PEO, instead of working with a company like ours, healthcare back offices, you're going to find that you're going to be spending even more than that in your payroll costs, closer to 30% or even 35% of your payroll cost are going to be additional fees. So just to kind of give you an idea of what I mean, if you're paying a nurse $30 an hour, the real cost to you if you're doing it yourself is going to be about $35 to $36 an hour with workers' comp and everything else loaded into that. Okay, so it's not just the $30. If you're working with these other back offices, not our back office, it's going to cost you maybe even $40 an hour to employ that $30 an hour nurse because they're going to be providing you with services, covering your workers' comp, covering your payroll, but they're going to be charging their fees on top of that and making a profit on you. That is kind of outrageous in my opinion, especially if you start to do size. So when you're calculating your pay rate, always remember those are things that are going into your pay rate. Now we have a beautiful spreadsheet that we use within our company and that we use with our clients that actually allows you to calculate this in real time. What you'll see is that we'll have our proposed pay rates on one side and then all the additional cost kind of spread out so that when you actually key in your pay rate, let's just say it's $30 an hour, you'll see exactly how much that's costing you per an hour in real cost. And then it's also measured against your bill rate to see exactly how much you're earning per an hour for every hour that's worked. It's a really powerful tool. Our custom spreadsheet is accessible to our clients only. If you wanted to share it with you so you could accurately set your rates, negotiate with facilities, and know down to the penny what you should be paying and billing, you can book a one-on-one consulting session with one of our team members to get you up to speed. When teaching clients how to formulate rates, I often see that they don't know how to do market research to determine the competitiveness of their rates. Here's how my HR team does it. When you're just getting started, you're not going to really know what the market is commanding in pay. So what our team does to determine what is the market rate for employees is that we examine a few different resources. The first thing that we start with is kind of a general Google search. You could literally go into Google and say, how much are RNs, LPNs earning in X zip code in X city? And then they're going to give you a average, or they're going to give you a chart that demonstrates what is on the low end, what is like the median rate, and what is kind of the high end. And that's going to vary based on, are they BSNs, are they MSNs, are they supervisors? It's going to be a blended rate. But that's going to give you an idea of kind of the range. So that's one data point that you can use. You also should be looking at Indeed. Some of the job postings in Indeed are going to specify the hourly billing rate or the annual rate. A quick way to get the hourly rate from the annual rate is to just divide that annual rate by 2,000 hours, right? So if you're thinking about a 40-hour work week, it's about 2,000 hours. If it's a 36-hour work week, it's about 1920 or 1960, something along those lines. Easier number is just 2,000, and that should give you the roundabout hourly rate. So that's another data point for you to kind of come up with what is the market commanding. Another thing that we really like to do is that whenever we're putting out ads in a new area, we get feedback from the worker. What is the acceptable pay range for you? What are you looking for? And I let the employee respond, what is the pay rate that they're looking for? And that gets set as another data point. We also ask other companies in the area, or we ask facilities to disclose exactly how much are they paying. You could call their HR department and say, hey, I'm an RN looking for work here. What is the expected rate? Another thing that you should be taking into consideration is whether or not these are kind of per diem workers, meaning that they don't have any benefits, or are these wages the expectation of a W-2 earner with benefits? There's going to be a difference in the amount that they're getting paid. A lot of the other agencies, especially the smaller boutique agencies, they usually don't design benefit packages. So what they're paying their staff is like a fully loaded rate that's pure, exactly what they're getting compensated. That's usually going to be on the higher side. Now, when you compare that to facilities that are hiring directly, you're going to notice that the pay rate is going to be a bit lower for their full-time staff. The reason for that is that difference between the per diems and the full-time staff is the budget that's being used for their benefit package. So if you notice that there's a $10 an hour spread, then you know that that company is spending or investing about $20,000 or so per year in the benefit package. That's going to be paid time off, medical benefits, retirement, etc. Doing this bit of market research is going to give you a lot of insight into exactly what people in that marketplace are getting paid. Another thing that you want to take into consideration is that you want to consider what facilities they're working in, what type of facilities they're working in. Hospitals may pay different from skilled nursing facilities, which may pay different from ALFs, which may pay differently than a school setting. So you want to make sure that you're comparing apples to apples and oranges to oranges. But by researching in this way, you'll get a good sense of what the market is commanding per position group. All of what I'm sharing here is also in greater detail in our online courses. They're packed full of information to guide you in the right direction. We also work with a handful of clients where we provide full service setups so they're able to launch with minimal difficulty. The last thing I want to cover are the common mistakes operators make when designing their pay rates and what you should do to avoid the same fate. So earlier I mentioned something about W-2 employees. And what I want to highlight here is a common mistake that I see other people make. And that's choosing to go with 1099 independent contractors when they're starting their nursing agencies. The reason they do this is because, quite frankly, they're either trying to dupe the system or they're just flat out cheap. And it's really a dangerous practice. The thing is, as a nursing agency or a healthcare staffing firm, you are the employer of record. You're telling those employees where to go to work. You're telling them what time to show up. You're telling them to deliver documents to you. They're reporting their time to you, and they're getting paid directly in exchange for this. These aren't unique contractors where they're saying, hey, for this period of time or for this project, this is my fee. They don't have legal representation. They typically don't carry their own workers' comp coverage. There's so many things that are wrong about functioning as a staffing firm and using a 1099 structure. But the reason they do this is because once you're 1099, you're not responsible as the employer to provide workers' compensation for that person. You're also not responsible to withhold taxes or pay your employer taxes, which hurts the contributions to Medicare, which hurts the contributions to SSI. And especially Medicare, you should be concerned with because oftentimes it's Medicare dollars and government medical dollars that are funding the facilities that you're placing staff in the first place. So it's really not the sort of relationship the government wants you to have as an employer with the workforce. And because of that, people think that since they're skirting the mandatories, the SSI, the Medicare, unemployment taxes, etc., that they can offer higher pay rates to make their job seem more lucrative to nurses. And then they turn around and negotiate lower pay rates with facilities. So their spread gets smaller, they're compensating their staff more, and they think this is a good strategy. And the reason why it's not a good strategy is because it opens you up to tremendous liability. Let's just say a nurse gets injured on the job and they're out of work. They're going to sue you for sure. They're going to sue the facility. It's going to be a mess. When you're trying to sell that company, it's going to also be a problem because a more sophisticated buyer is going to know that that is a no-no. And they're going to see all that risk and say, wow, for the past 5 years, you haven't paid taxes on your employees and you haven't paid workers' comp? Do you have any outstanding workers' comp claims? Could this come back and bite me in the rear? Because of that, they're going to actually pass on purchasing your company or really strip down the valuation of your company. I'm actually dealing with a deal like this right now where we're trying to recast the financials and put clauses into the agreement in buying this agency that if this becomes an issue, the seller is going to be financially responsible, not us. So again, you definitely want to set yourself up properly. Do all your calculations where you're considering these people as employees. Use spreadsheets like the ones that our team could provide you with so that you're accurately getting the information that you need, so that you're designing your bill rates properly, and that you're not putting yourself in trouble with workers' comp or with any of the Department of Labor's that you're working with. Still not convinced? Check out this video where I cover in detail the difference between wage earners and independent contractors. The wrong setup could cost you millions.